Hello everyone, welcome you all in our YouTube channel Learning Radiology. Then start about today's topic. This topic is emergency crash cart. So today we will discuss on emergency crash cart. What is crash cart and usage of crash cart, advantages of crash cart, and where we use the crash cart in a hospital. Let's start. A crash cart, also known as a trolley for life-saving equipment. In crash cart, we store life-saving equipment and drugs which may be required during a cardiac pulmonary arrest. It occurs in a hospital, emergency room, ICU, clinics and other areas. A crash cart also provides an easily accessible position which is in central to the patient care area. When we talk about the history of crash cart, so cardiac crash cart or first cardiac crash cart was created at a Bethany Medical Center in Kansas City, Kansas, and the first crash cart was fabricated by one of the doctor's fathers. It contained an ambu-bag defibrillator, pedals, a bedboard and endotracheal tubes. Here is an image of a crash cart. We show the drawers of crash cart and noise-free anti-binding casters in wheels, aluminum alloy modular pillar, defibrillator shelf, ABS plastic modulator frame. And what is the purpose we use a crash cart? So firstly we will discuss is a store life-saving equipment and drugs. Then what is purpose? Firstly, to enhance the code blue team response to patient with emergency medical situation by providing immediate access to supplies and medication. A crash cart is a cart that facilitates coordination of emergency equipment, and a specific cart which facilitates staff familiarity with equipment. It is helped to ensure a properly stocked emergency cart will be readily available. It also ensures a properly functioning defibrillator will be readily available. It helps to save the valuable time at the time of emergency. Content, like which medicine we use in crash cart or we kept in a crash cart drawers. There's 5 drawers. Some crash cart have 4 drawers, some have 5 and some have 6 drawers. The content of crash cart vary from hospital to hospital, but typically contain tool and drugs. But whether crash cart have vary, but all the equipment and all the drugs contains in crash cart must include crash cart and which help in cardiac arrest at the time of cardiac arrest. Advanced cardiac life support drugs like epinephrine, atropine, amiodarone, lidocaine, sodium bicarbonate, dopamine, vasopressin. It also includes emergency drugs. First line drugs for the treatment of common problems like adenosine, dextrose, diazepam, epinephrine, naloxone, nitroglycerin, and the drugs for rapid sequence intubation, paralytic agent like pancromum, and a sedative drugs such as etomidate or midazolam, endotracheal tube and other intubing equipment. Vascular access devices like IV cannula, drip set, IV fluids, lactate ringel and hydroxyethyl starch. Other drug equipment chosen by the facility. Type of crash cart. Crash cart divided or are classified on the based of age and development variation, like adult emergency crash cart, pediatric emergency crash cart and newborn intensive care crash cart. Firstly, maintain about the crash cart. Because crash cart contains drugs, then drugs have a expiry period. So after that we will not use these drugs. So maintenance of crash cart is necessary. So in case of maintenance, it should be completely at least monthly, routinely maintained. Expiration date on the medication should be checked on the first day of month. Expired medicine should be removed and replaced. The defibrillator pads and AED or the defibrillator should be checked for the expiration date. Battery charge or monitor and AED should be checked and documented. A licensed staff member as designated by the head of the department is responsible for the checking the crash card and the oxygen cylinder levels, defibrillator, documenting compliance on crash card checklist. Each emergency crash card is equipped with the lock and kept unlocked unless in use. Oxygen cylinder are replaced when tank has emptied. When tank has emptied, replace the oxygen cylinder. Drawers of crash card are to be clearly labeled to identify content. A special procedure tray is kept on the bottom shelf. Function of crash card: it to provide the mobile station within the hospital that contains everything needed to treat a life-threatening situation like advanced cardiac life support, advanced life support, pediatric advanced life support to potentially save someone's life. The advantage of mobility is to allow the treatment to come the patient when needed. Arrangement of crash card: top shelf, defibrillation, SpO2 probe, ECG strips, ultrasound coupling gel, ambu bag adult with mask, ambu bag pedia with mask. These are the images we show the arrangement of a crash card. Policy: crash card must be checked by head staff nurse every shift in the document and checklist. Standardization must be maintained. Defibrillator should be checked by biomedical department regularly. It must be checked monthly for expiry date. Each unit will have crash card placed in an easily placed accessible location. And procedure for the crash card: portable suction apparatus with connecting tubing if not available in each patient room. Portable monitor defibrillator unit with charge batteries, multifunction cable, multifunction pads, pacer cable, ECG electrode, and etc. Arrangement of medicine and equipment in crash card is different from different institutions based on their policies. Every institution have different policies. So firstly, based on the airway breathing circulation, and second, based on the need and necessity of medicine and equipment. Firstly, we will discuss airway breathing and circulation. For drawers 1, use medication like emergency drugs, adrenaline, atropine, adenosine, aminodarone, verapamil, degosine, dopamine, dobutamine, levopad. These are the measures. Drawer 2, breathing and airway management. Like we use dextrose 50%, lidocaine, placil, sodium bicarbonate, ambu bag, nasal cannula, oral airway, intubation tray, suction catheter, all related to the breathing and airway management. Third one, circulation, like laryngoscope, electrodes, xylocaine jelly, stylate, oropharyngeal airway, gauze, bandage, plaster, IV supplies, 3-way, blood kit, and etc. Fourth drawer, it contains IV solution and tubing related to circulation, like endotracheal tube in various sizes, tracheostomy tube, airway, suction catheter, gloves, IV tubing, macro and macro drip, and etc. Cardiac chest procedure kept in a drawer 5, like ECG electrode, restraint, sterile gloves, scalpel with blades, dressing drain, sponge, betadine solutions, sutures, cardiac needles, sterile towels, chest tubes, and etc. Second one, based on the need and necessity of the medicine and equipment. First one, medicine. It again classified based on the priority, first, second, and third priority medicine. And in second one, equipment like Ryle's tube, micro set and micro set, blood set, IV splint, micro pore, gloves, kidney tray, ECG electrode, and jelly, tourniquet, spiritual. In IV fluid, like NS 9% 500 ml, NS 9% 100 ml, isolite, P Valvain 500 ml. Fourth, open tray on the top, disposable syringes, extension number 10 cm 200 cm, IV cannula, needles, intraosseous needle. Fifth, bottom crash card like plastic apron, intubation tray, intubation pillow, ICD set, percutaneous tracheostomy set. Here the imager we show the front view of the crash card, and it showed the side view of the crash card. We show oxygen gauze, oxygen compress, tank. In case of pediatric crash card, using different type of crash card by using Boas yellow card, like a color coded pediatric code blue card, tape, which containing age-specific supplies and medication for pediatric patient. The borosilicate cart is designed to provide appropriately sized equipment for a pediatric patient. Other one, each drawer is color-coded and contains supplies based on the age, weight and patient. Other one, the top drawer contains medication for all ages. Borosilicate pediatric emergency tape. So nowadays the different type of crash kit are also available. It contains different emergency drug, oxygen system, disposable respirator and manual section unit. So this type of crash kit help us to deliver ACLS measure outside the hospital setting also. Thank you. Comment on this video, like the video and subscribe the channel. Thank you.